All right, so I'm just going to answer some of these questions for our discussion after these two articles. How do we apply the communication guidelines and the bullying or whatever to our nursing practice as a new grad? I think as a new grad, it's important. Honestly, so as a new grad, I think we look up to a lot of the experienced nurses in like how to communicate with patients and how to like even complete tasks. And so I think it's hard when there's a bully at work to complete those tasks because you also are looking up to the coworkers that are also more experienced. And then I also liked the communication guide because it actually was really eye-opening for the I statements and the you statements. Like, I guess you don't realize how like informative and how much better, I don't know what the words to use, but how much better it can sound when using those, and how much more meaningful it is for the patient and yourself, honestly. I think, how does this impact healthcare on a local, national, global level? I think if everyone treats everyone fairly and not necessarily the same, but the same, I think that it'll change everything. I think also for the communication standards, I think if there's effective communication, like proactive, assertive communication, like the article is talking about, I think a lot of more things would get done. A lot more people wouldn't have their feelings hurt, kind of just stuff like that. So I think, honestly, like if one hospital did that, it would make a difference for another hospital to do that, and then it would just like create a tier of healthcare exceeding in different ways. My personal experience with this, I don't feel like I've really had a bully at work necessarily. I don't feel like I've been a bully at work either. There is one nurse that is kind of more bossy when she's talking, but I think that's just her personality. I don't think she really means to do it that way. But I still look up to her for things, like for tasks on how to do things sometimes, or sometimes how to communicate. But I feel like I've gotten a lot better at communication with patients and their families, so that's kind of helped me. Sorry, my questions went away. Okay. And then, is this something that you can apply to your capstone experience? Yes, absolutely. I think one of the things that I really wanted to work on through my capstone was communication, because I feel like you watch people and they just know what they're like. You watch the nurses now communicate with the doctors and the families, and they just know what they're doing, like, and how to communicate it. And I feel like in clinical we get to see that, but we don't actually get to experience that. So that's something that I want to work on in my capstone, because that's something that we can like really implement and start there, if that makes sense. And then also relate it to my work life. And then, what are some barriers or challenges you may face regarding this topic in the work setting? I think it's hard, because I think anywhere you go, there's going to be someone that is kind of more of a bully, which is hard because you have to deal with them. But I feel like I haven't really had one necessarily that I've like thought was like a legit bully. But I mean, I think some people just have different personalities than others, which make them seem more, like I said, bossy, or more, I don't know, not as comforting to go talk to. Not as, anyway. So I think, actually, I can do this with a provider that I've talked to before. He's just not as approachable. Not that he's rude or anything. He's just not as approachable, so it's kind of harder to talk to him. I think, honestly, though, from reading this, if I could use my effective communication towards him, he's probably able to use more of his effective communication towards me. So I think it goes both ways. If I can kind of start that, and then he can kind of go from there with what I'm saying to him. How does this influence your clinical decision making? I think a lot of ways. I think it influences patient care. And then, like I said, with communication with the providers, the doctors, any of the healthcare team, the aides, because everyone's important. And I feel like if you make everyone feel that they have a role and that they're all important, that, like I said at the beginning, like it kind of goes far and it goes up a ladder. And if you have, if the bottom of your ladder is doing really well, it helps the next row in the ladder, and then it just keeps building and building up. So anyway, that's kind of what I have to say. Anyway, hopefully you guys aren't, I don't know. Okay, thanks. Bye.